The prisoner ombudsman is calling for improvements to be made to the healthcare provided at Maghaberry prison. He's released a report outlining a number of missed opportunities in the case of an inmate who died from an inoperable brain tumour. Ombudsman Tom McGonigal says the report is not about apportioning blame.
My preference is to try and help the prison service and, in this case, the South Eastern Trust do things better. The Trust have accepted the recommendations, and I'm taking it in good faith that they will implement the recommendations that they have accepted. Whenever we subsequently come to look at other death and custody cases, we always review recommendations that were made and accepted, and that will be no different in this case from others.
Well, the prisoner concerned, who's referred to only as Mr H, was represented by Madden and Finucane solicitors. Katie McAllister is from the law firm. Good morning to you.
Good morning.
Just remind us of the circumstances of what happened to your client.
Well, he had become very unwell whilst in prison in Maghaberry. He'd been unwell for a number of months. But basically it all came to a head when he was admitted to hospital with severe dehydration and malnutrition. That was when we and his family became aware of his illness.
4 opportunities were then missed to diagnose an inoperable brain tumour, and the prisoner died less than 2 months after he was released. How have his family reacted to the Ombudsman's report?
Well, they welcome the findings of the report. They obviously have set out 15 recommendations where the care provided wasn't adequate, and recommendations for it to be improved in the future. They have great concerns about the treatment that he did receive on a number of fronts. Obviously, there were indeed 6 missed opportunities to diagnose the condition going back as far as 2010, where he had seizures which went uninvestigated, and the independent GP commissioned by the Ombudsman stated that had the seizures been investigated at that time, that it might well have had a different outcome for our client.
The prisoner ombudsman did say that earlier diagnosis would not have saved your client, and the investigation also found that some of his care had been very good, and several prison officers and nurses had shown compassion for him while he was in Maghaberry jail. Do the family accept that?
Well, just to address your first point there, in the prisoner ombudsman report, in respect of the seizures in 2010 and 2013, the findings were, in fact, that it might well have reasonably made a difference to the final outcome. The 4 further missed opportunities at the later stage were thought not to have been relevant to the overall condition, and that would have only led to an improvement in palliative care. But it does go beyond that to the 2 previous missed opportunities. That was the family's position, that there would be overall concerns about that.
The Trust has also apologised to the family and says it's taking the 15 recommendations on board. Has the family responded to the Trust?
No, the procedure wouldn't be that the family would respond to the Trust. That we have liaised with the prisoner ombudsman in respect of this and raised our concerns through meetings with myself and the family with the prisoner ombudsman, and all concerns being raised through that avenue.
Are they satisfied though with what the Trust has said?
Well, they do welcome the findings of the report. They're now considering what do they do going forward, and they're considering all legal options open to them, including the possibility of issuing proceedings in respect of negligent treatment that their son did receive.
The prisoner ombudsman, Tom McGonigal, said this report highlights the need for someone to actively take charge and manage the first line clinical care of patients in prison where families are less able to assist or advocate on their behalf, something that your client's family would advocate for.
Yes, absolutely. I mean, my client's family weren't actually aware that he was unwell at all until he was brought to hospital with severe dehydration and malnutrition. That was occasioned by reason of him being physically unable to get out of bed. The guy was literally lying in his prison bed, unable to get to the surgery to get water and to collect his meals, and therefore these meals weren't brought to him. A number of other fellow prisoners had contacted our office raising these concerns and said that they were in fact bringing him food and water, which seemed to have been really all the assistance he was getting within the prison, which would raise a major concern on compassionate grounds as to how he actually spent his last while in prison.
Just finally, you said that the family are considering taking further action.
Yeah, they're accepting advice on that at the minute and considering their options.
OK, Katie McAllister from Madden and Finucane Solicitors, thank you very much for speaking to us on the programme this morning. Well, in a statement, the South Eastern Health and Social Care Trust said it accepted all of the recommendations of the report, stating they are committed to implementing improvements as a result of the lessons learned from all investigations. The Northern Ireland Prison Service said it's determined to use this report to strengthen systems already in operation throughout Northern Ireland's prisons.